I'm confident that after watching this video, you will be able to provide treatment to a type 1 diabetic patient. I will explain it in a way that sticks in your memory so you will never forget it. Now, imagine a type 1 diabetic patient asking for treatment. Can you help him? Hello everyone, let's get started quickly. In brief, insulin is the primary treatment for type 1 diabetes mellitus. Now, let's talk about the types of insulin. 1. Rapid-acting insulin. 2. Short-acting insulin. 3. Intermediate-acting insulin. 4. Long-acting insulin. First, let's discuss rapid-acting insulin. There are 3 types. 1. Aspart. 2. Lispro. 3. Glulisine. How can we connect them together? Just remember this image: an athlete is running rapid, which helps you recall that it refers to rapid insulin. He participates as a part in this competition, but he's less pro than the other athletes, because his feet stick like there's glue on them. Now, remember the scenario and repeat it with me. Just remember this image: an athlete is running rapid, which helps you recall that it refers to rapid insulin. He participates as a part in this competition, but he's less pro than the other athletes, because his feet stick like there's glue on them. Perfect. Now let's connect the brand names with athletics. After the competition, he wrote a human novel about logarithms. Human leads to Humalog, Lispro, and novel leads to Novolog or Novorapid, Aspart. If you look at the last part of the story, the brand name of glulisine is Apidra. If you focus on the letters in Apidra, you will see the word rapid, which also helps you remember that it refers to rapid insulin. The second part of this video is the easiest part. When you hear short-acting insulin, remember a patient's hand receiving an IV, because short-acting insulin is the only type that can be administered intravenously, IV. The letter R in short will help you remember the R in regular, which is the generic name for short-acting insulin. The brand names are easy to remember because they are similar to the rapid-acting insulin generic names, except we replace log with lin. And, of course, the R refers to regular. Thirdly, intermediate-acting insulin. Look inside your car, and you will see the letter N, which stands for neutral. So, intermediate means neutral. The 2 generic names start with the letter N, and as we said, N refers to neutral. The first one is NPH, neutral protamine hagedorn, also known as isophane insulin suspension. The second one is NPL, neutral protamine Lispro. Wait a minute, do you recognize Lispro? Yes, from the rapid-acting insulin. The brand names are the same as short-acting insulin, but we replace R with N. So easy, right? After subcutaneous injection, proteolytic tissue enzymes degrade the protamine to allow insulin absorption. Lastly, there's the long-acting insulin. Imagine a garage with a detimer to wash each car. Garage refers to Glargin, and detimer refers to Detamir. Brand names: Lantern refers to Lantus. Imagine a garage with a lantern that stays on all night, representing its long-acting effect. The other brand name is Levemir. Think of the first 4 letters, LEVE, and memorize it as long level. Both Lantus and Levemir start with L, which stands for long-acting. Ask yourself, what makes this type long-acting? It has a fatty acid side chain, which prolongs its availability. It has the most reproducible effect, and its use is associated with less hypoglycemia, compared to NPH insulin. There's a surprise. A type 1 diabetic patient will take a combination of these insulins, not just one type. There are 3 simple combinations, and you already know them. 1. Combination of intermediate NPH with short regular insulin in 2 percentages, 70% NPH, 30% regular, 50% NPH, 50% regular. Examples: Humulin 70% 30%, Novolin 70% 30%, Humulin 50% 50%. Note that Humulin and Novolin are the brand names for intermediate and short-acting insulins. 2. Aspart protamine and Aspart in only 1 percentage, 70% Aspart protamine, 30% Aspart. Example: Novolog mix 70%, 30%. 3. The third and last combination is intermediate NPL with rapid-acting Lispro. We have one drug in 2 percentages, Humalog 75%, 25%, Humalog 50%, 50%. Humalog is the brand name for rapid-acting Lispro insulin.